You are listening to Hypertension Resistant to Treatment, where you will get knowledge, training, resources, and support for better blood pressure control. If you are suffering with high blood pressure or blood pressure that is difficult to treat, this podcast is indeed for you. Here is your host, Dr. Tanya.
Hi, I'm Dr. Tanya, and I am here to teach you everything you ought to know about hypertension management. I am a clinical scientist, and I've done research over 10 years, and I've found some interesting things about hypertension and blood pressure control and medication taking behavior. I would like to share with you all of the information I've found, as well as all the information that's out there that will help you get control of your blood pressure. Stick with me, and we'll take this journey to help you improve your blood pressure. Thanks for listening. Have you been told by your healthcare provider that your blood pressure is elevated, but when you're at home, your blood pressure is normal or at your target goal? This is common. 10 to 35% of people have this problem. This is called white coat syndrome or white coat effect. Has your blood pressure ever been normal at your doctor's office, but at home it's elevated? This is known as masked hypertension. It is rarely treated because it's difficult to detect. There are many reasons to monitor your blood pressure at home. I will discuss 5 major reasons
where
in this
you
podcast.
will get knowledge, training, resources, and
I will
support
tell you
for
what
better blood pressure
everybody
control.
ought to know
If you are
about
suffering with high
hypertension.
blood pressure or
Everybody
blood pressure
ought
that
to
is
know
difficult to
to
treat,
monitor their
this
blood pressure
podcast
at
is
home
indeed for you.
and share
Here is
their
your
readings
host,
with their
Dr.
healthcare
Tanya.
provider. Using a home blood pressure monitor, you can rule out white coat effect or white coat hypertension. You could detect masked hypertension. You can improve your blood pressure control, and you can improve your cardiovascular outcomes. Not to mention that the hypertension guidelines have recommended home blood pressure monitoring for decades. But the most important reason why you should use a home blood pressure monitor is because it's the most accurate blood pressure monitoring that you can do. You see, the 24-hour ambulatory blood pressure monitor is the device used to get the most accurate blood pressure that you can get. But a home blood pressure monitor is just as accurate as that very expensive 24-hour monitor. You see, the gold standard for getting an accurate blood pressure is to use a ambulatory blood pressure monitor device that's strapped on you for 24 hours, and it monitors your blood pressure at fixed intervals between 10 to 30 minutes as you perform your usual daily activities. Yet, home blood pressure monitoring is not a common thing. Although your blood pressure readings are very useful for your healthcare provider to determine if your blood pressure is at target or not, it can be very time-consuming for your healthcare provider. So do yourself a favor, download a blood pressure log from the App Store. This can help you and your healthcare provider tremendously. It will help you because you will have your blood pressure measurements anytime, all the time, and you'll never forget them when you get to the doctor's office. It'll help your healthcare provider because it'll take seconds for your healthcare provider to take a look at those numbers It could be a week's worth, and it'll take less than 5 seconds to see if you're at your target goal or not. Any one of the blood pressure log apps would do. But the one I prefer is the one called BP Monitor. The BP Monitor app is just easy to use. Or you can consider purchasing a pocket calendar that would be used to insert your blood pressures in the date boxes. I've seen that to be very useful as well. Whatever you do, measure your blood pressure in the mornings and in the evenings. If you are on blood pressure medicine, you want to measure your blood pressure before you take your blood pressure medicine. It's in the morning, and then you'll get your blood pressure in the evenings after you've had your blood pressure medicines. Measure 2 readings, 1 minute apart. Get at least 3 to 7 days of blood pressure measurements before your next visit to your healthcare provider. If any time your medications are being adjusted, you also want to measure your blood pressure. Know when to call your healthcare provider. Make sure you call your healthcare provider if you get any severe blood pressures. I recommend an Omron brand monitor because that's the brand we use in the clinic and in research. Matter of fact, I think that's the monitor that is used in most research that has been done. Get the right size cuff. Measure your bicep to make sure you have the right size cuff. There are many reasons to take your blood pressure at home with a home blood pressure monitor. Get a home blood pressure monitor and monitor your blood pressure, log your measurements, and share your results with your healthcare provider. Then you will reap the benefit of better blood pressure control. Stay tuned to Hypertension Resistant to Treatment, where I will tell you how you can determine what your 10-year cardiovascular risk is. Thanks for listening.